There's a fresh warning this afternoon about a holiday virus which can impact the health of babies. It's a Zika virus that's making the news again right now. Our resident Dr Tamara Hunter says we shouldn't be complacent about its dangers. Dr Tamara, thanks for joining us.
Yes, I am.
Now, firstly, can you refresh our memories? What's the Zika virus and where's it found?
Yeah, so Zika virus is one of a group called the flaviviruses in the same family as dengue virus and yellow fever. It's carried by mosquitoes. The particular species is the Aedes species, found in urban areas and also during the day, so very different to what we expect from when mosquitoes come out. Now, the Aedes species is now found throughout Southeast Asia and also in the top of Australia as well. So, although we haven't found any cases of Zika virus in Australia as yet, certainly with, global transport and people going here, there and everywhere, it's certainly possible that Zika could come to Australia very soon.
OK, so who does it show up in?
So main transmission form is through mosquito bites. They can bite children, women, men. It can show up in anyone. About 20% of people will show symptoms, rash, fever or even sore joints. So that means 80% of people have no symptoms whatsoever. The biggest issue is we now know that there is transplacental transmission of this virus. So a pregnant woman can contract the virus, transfer it to her unborn fetus or baby, and that baby can be born with something called congenital Zika syndrome, which is a combination of microcephaly, where the brain doesn't develop properly, spasticity, seizures, muscular disorders, and so on. And now in Brazil, where we know that there is an epidemic, 1.3 million babies have been born with congenital Zika syndrome.
And if you contract this virus at any stage of your pregnancy, does that matter then as well?
Yeah, absolutely. And the group that I see is a lot of young women, young couples planning to get pregnant. They pop off to Bali or Thailand or Malaysia for a quick baby moon before they decide to have their baby, and that's possibly the worst thing that they could be doing.
And what are the top 5 things we need to know about the Zika virus?
Well, we know that the main form of transmission is certainly through mosquito bites, but during pregnancy, sexual intercourse. We also know that Zika virus has been found in tears and also breast milk, so it's really important that we protect ourselves from being bitten by these mosquitoes in the high-risk places. The high-risk places being Malaysia, Singapore and the Philippines, even Vietnam. All of these are considered moderate to high risk on smarttraveller.com or even the CDC. And then making sure that you do not have unprotected sexual intercourse. Well, if a male comes back from one of the affected areas, for up to 6 months.
OK, and how long is it in women as well if they have then contracted it?
So the current Department of Health guidelines is that a woman on exposure to a high-risk country or an infection should not have unprotected sexual intercourse for 8 weeks, and as I said, for a man it's up to 6 months.
OK, Dr Tamara, thanks very much for coming in, and have a great weekend.
Yes, you too.